Hi, and welcome to the Lioness Den. This is our women's channel where we discuss topics pertaining to women. And today we have a great lineup of women who are here to discuss their leading during the pandemic. I'm going to introduce each lady, and they're going to tell us a little bit about them before we get into this discussion. First, I'd like to introduce Senator Mary Washington of the 43rd District of Baltimore. Senator, how are you?
I'm good. How are you doing?
Wonderful.
It's a pleasure to be here.
Oh, thank you for coming. And then we have Pastor Linyar Robinson from Dream Life Worship Center. How you doing, Pastor Robinson?
I'm good. Good afternoon. Hope all is well with you and everybody else.
Yes, ma'am. And we also have Miss Stephanie Flynn. She is a clinician at the Hanger Clinic. Hi, Stephanie.
Good morning, everybody, or I should say afternoon. Happy to be here.
Okay. Thank you, ladies. We're here today to talk about a very important topic, which is women leading during the pandemic. And all of you ladies have been in a leadership role in your different careers or avenues that you serve in. I want to start by saying thank you to everyone here who, you have put yourself on the line in some ways by going out to make a difference for us in our city, our state, and this country. So I applaud you and I thank you. And I just want to kind of jump right into the discussion about leading during the pandemic and get the information out there so people will know what is going on, what may be going on, and what we're doing to help. I'm going to start with Senator Washington and talking about the pandemic in the state of Maryland. Senator, can you tell us right now what the state of Maryland is doing as far as the pandemic goes?
Well, first of all, thank you so much for being here. It has been exactly a year Friday that the first confirmed case and then subsequently death related to COVID in Maryland. So we have officially had a year of various phases of lockdowns. Again, I'm State Senator Mary Washington. I remember we were in the middle of our legislative session last year, and we closed the session down March 18th because of COVID. And immediately, just like you, we started trying to figure out how we could keep ourselves safe and our families safe, but also how do we work with our families. In the 43rd District, we set up a 43rd District COVID response. And thank you so much, Barnes Memorial, and thank you, Lydia, for being a part of that, providing food services, trying to help people get their pharmaceuticals picked up. I mean, none of us knew really how it spread. You know, we had some ideas about how it spread, but we just didn't know a lot. But today, since the vaccines have become available, cases have declined, but we still know that if we continue with the vaccination strategy and it can work, and we'll talk about those disparities in our communities, that we can continue to see some progress. I think one of the things that we want to make sure as legislators and as from a policy perspective, that even if we have a vaccine, we need to make sure that we are still washing our hands, that people are wearing masks. We know that on an economic perspective, the jobs haven't come back yet, and we still need to work on that, all of that. But I want people to know that from a state perspective and a city perspective, we still need to focus on testing, making sure that people get tested, making sure we can help people find the vaccine, making sure that we're contact tracing when people are infected, making sure that you can connect with people. As you know, initially our nursing homes were hit hardest, our older citizens. Everybody in congregate care was hit hardest, where we shut those nursing homes down, but they're going to open up again for some outside visitations. So those of you who have loved ones who are in assisted living or nursing homes, the governor has relaxed and is allowing there to be some opening. But again, I'm just to be honest, lady, I'm cautiously optimistic. We saw this before, right? We saw the cases decline, everything opened back up again, and then the cases went up again. So, I think that we stay in touch with our health department, stay in touch with our family and friends, keep safe. But we're going to keep working to make sure that people get through this.
Yeah, it's a very difficult time right now, and it's getting better. I have to say that it's getting better. The news makes it look better. That's what I will say. The numbers are going down, and things seem to be getting safer. But we have to stay on alert. Lady Lanyard, you guys have been doing a lot at Dream Life also. Can you give us some information, because I know that you guys also was hit just like everyone else with the pandemic happening, and can you tell us about what you had to do at Dream Life just to make things safe?
Absolutely. Well, thanks again for having me, Lydia. Yes, thank you, Senator, for that reminder that it has been 1 year. And like Senator said, none of us anticipated this at all. I can remember when we first received the stay-at-home order, and there was a little bit of exhaling going on because you felt like you're going to get some much needed rest, no ripping and running, kind of, some leniency on some demands that were on your life, some things on your timeline. For those of us who have children of whatever ages, not running them around to all the different activities they're involved in, let alone school. So it was kind of like a woosah, okay, let's ride this out for a couple of weeks. Let's enjoy this. Let's cook some stuff, bake some stuff, and, get caught up. No. So here we are a year later. And for communities of faith, and particularly churches where I pastor alongside my husband, Kenneth Robinson, every need in the world is an open door to share God's love. Every need in the world is an open door to share God's love. And so here at Dream Life, that's what we did. We took the opportunity, we stepped into that open door to serve those who are most vulnerable. Like the church has done historically, the local church historically has used these open doors to serve those who are the most vulnerable. And I'm very proud of that. I'm very proud of not only our local church, but I'm proud of the work that the local church does in our communities throughout history. And so here at Dream Life, certainly, we stopped gathering in person even before an official stay-at-home order was put in place. We had in mind our parishioners who are older, our parishioners who have pre-existing conditions, our parishioners who have very young children. We just wanted to take the safe route and not take any chances. And so we started that. We continued our live streaming to our services, our worship services. We upgraded our live streaming so we could reach more people, so the quality will be better, the sound will be better, so people could feel like they were still connected to their local church. We also do food drives. We have been doing food drives. We increased the frequency of our food drives. Our next food drive is the second week in March to meet the needs in the community where people have loss of income. People have been struggling. People have been forced to stay home with their minor children, and, there may be hourly. So we do a food drive. We have also put in place our live virtual life skills classes, things that we were doing in person on site. We changed to doing them virtually so that the people who needed those services, who needed those classes, who need the virtual Sunday school, virtual life school classes, virtual substance abuse recovery, those things we translated to complete virtual. And then lastly, when we started to regather at a certain percentage, we found it very important not to put any excess pressure on anybody to regather in person. Those people, we didn't want people to feel like you have to be here to experience the love and the presence of God. We know that the presence of God is everywhere. But for those people who wanted to come back, some people live alone. Some people away from their families, they need the sense of community that gathering on Sunday offered them. And so what we did was we put our social distancing in place. We purchased the decals. We put them on the floor, 6 feet apart. We require mask at entries. We have our registered nurses at our door checking temperatures, making sure that all of our parishioners are filling out contract tracing forms, staying a certain amount of space apart, at least 6 feet in the sanctuary, sanitizing our sanctuary, every touchable space. We put up the plastic dividers in the reception area, everything that we could do to ensure that our parishioners were safe, and yet they were able to come and experience the community that we bring. That's what we have done. We've just stepped into the open door to serve the love of God during this time.
That is absolutely wonderful, because right now people, they're still afraid, and so they need that extra push to say we care, we care.
Yeah.
And I'm so happy because I know that Senator Washington has been working, and Dream Life. When I'm in town, I'm at Dream Life. Barnes Memorial has been working, so the church and state have kind of been working together to try to make this as easy as it can be, because we know that it's a difficult situation, as it is. Miss Stephanie has worked throughout this pandemic. Can you talk to us about what was done at your place of employment? Because I know that you guys went through some great differences with seeing patients and things like that, and making yourself safe.
Right. Yes, thanks for having me again. So I am a certified orthotic fitter. So Hanger Clinic is a custom bracing and prosthetics company. So, as far as I'm not a prosthetist, but I work very closely with those people. And, when you have an amputee, and amputations happen all the time. And so, and it's obviously a emergency situation in some cases. So, you know, I at one point was furloughed for a month, but only due to the location that I am at. So I am at a hospital. And since the elective surgeries were taken away, that's where our income kind of dropped. And so I was furloughed for a month, and only a month, thank goodness. And I was able to receive the, state money that helped out from unemployment. But we had other prosthetists and people that needed that help. And it was, we took the obvious precautions of sanitizing, and honestly, in a hospital setting, you're doing that anyway. So I would say it was just kind of ramped up, and a lot more partitions were put in place, and face gear, all that stuff. But it's I lost my support staff because, again, they were also furloughed. So I was kind of along by myself a lot of the time, which I fared well through, but it was also not easy. And, you wanted to make this as easy for our patients as possible. And so sometimes I felt like that was kind of difficult, but, we all worked together, my company and the hospital themselves, to really make sure that these patients were still taken care of if need be.
Yeah. I know a lot of hospitals went through a lot of changes with people coming in, and Stephanie, you work with patients coming in on a daily basis. So
Right.
do you guys do temperature checks for patients and things like that? Because you have to be safe,
Right. Yeah, absolutely. Absolutely. There's the temperature checks. We have our own thermal reader that we use when we see patients on our own schedules, because we also see outside patients from just, not just from the hospital. And then if there was a certain time frame that only certain surgeries were approved due to a certain level of it was a lower back issue and they lost feeling into their legs, that was considered emergent surgery. So then I would have to go see those patients in the hospital. But obviously they were also COVID tested before they were, allowed to have that surgery. But there was people and patients that kind of fell through the crack as far as they were tested negative at that point, but then a couple days later they were positive. So, there were times where it was like, oh, okay, but there's a lot of communication. So it was like, if this patient was tested positive after the fact that I saw them, there was that contact tracing that then got taken care of. And we used our hanger, resources, and then the hospitals, like occupational health, to make sure that everyone was taken care of that sense. But yeah, I mean, we were obviously doubled up, gloves, smocks, glasses, and goggles. So the whole 9 yards.
Yeah, I kind of understand how hot that can be in my profession. I used
Yeah, the fog.
it is not fun to be fogged up and all of that stuff.
Yeah.
But we're troopers and we get through anything to stay safe. I want to move on a little bit more to the vaccine and the availability. Senator Washington, how available is the vaccine in Baltimore, or even the state of Maryland? And the places where you can get the vaccine, is it readily known to people or easy to find?
So I know that many people who are listening today, that there are many people who want the vaccine who have not been able to get the vaccine. We've had, since it was first available, kind of in late December, Maryland, frankly, the state of Maryland has been behind. We've been ranking in the low 40s and the 30s in terms of distribution of the vaccine compared to other states and the District of Columbia. Only about 14% of Marylanders have received their first vaccine dose, and about 8% have received their second dose. And one of the issues, so I serve on, in the Senate, we created a work group to hold the health department accountable for the distribution, or frankly, the lack of distribution of vaccines. What we were seeing is that higher income white communities were receiving or able to get access to vaccines at a much higher rate than African Americans and lower income communities. And a lot of what the governor and what other people were saying is this idea of vaccine hesitancy, and this idea that somehow the reason that Black and brown people aren't getting the vaccine is because they don't want the vaccine. And so while we know there's hesitancy in our communities, there's hesitancy in every communities, but there are major equity issues when it comes to the distribution of the vaccine. In Maryland, Black and African Marylanders make up about 31% of the population, but only have received 16% of the doses. And when you look at places like Prince George's County, you have this where 15% of Maryland's population, but they have 17% of COVID-related deaths. Right, but they've only received 8% of the vaccine. So the work group and other people, and I know that probably people who are listening today have been telling the governor and saying, look, just simply distributing these vaccines through Walgreens and through CVS and just through the hospitals is not making it to the people who need it the most. And so now, having said that, the good news is, because of advocacy, like your advocacy and lots of other people, the city has been already setting up mobile units, and the state is starting to set up mobile units. There are vaccine sites, so mass vaccination sites. The other thing is now, with Johnson & Johnson approving another vaccine, we now have another vaccine that only needs one dose. So I would encourage people to call 211. Encourage people to call the health department. And also now many CVSs are starting to open up more. But we still need to stay on top of it. People who are isolated, people who aren't able to be online, people who don't have folks checking in on them, they're still not having access. So what we're asking people to do is, once you get your vaccine, try to get 4 other people, stay on the phone with them, help them go online, help them get those vaccines. So there's good news in that we're turning a corner and that the vaccines are becoming available. But just like everything else, just like food, just like income, the people who are most vulnerable are still having a hard time getting access.
Yeah, that is probably one of the saddest parts is that people who really need the help sometimes can't get the help because of income-based decisions.
Mhm.
Um, and that's where the church has come in
Yes.
so wonderfully right now because a lot of the churches have stepped out there. They always were, the church has always done things in the community,
Always.
but
Always.
they have really partnered with church and state to spread love. That's basically
Yeah.
it. Food
And
and all
spread
that
the
stuff.
word and now finally again, because what they do is they set up these big sites. And if you don't have a car, you can't drive to those, mass vaccination sites, right? Or if you don't have a Twitter account where somebody says, "Oh, there's vaccines available in this location, go now." And so now finally, I believe like it's working that the churches, the mosques, the locals are really being encouraged to, we don't need to see videos of athletes telling people to take the vaccine. They need their local community people to tell them it's okay and to work on it. So if you're able and I, so, just to be honest, I was nervous about it. So the vaccine, my mom's in a nursing home. Um, and I'd see her every day, and it came to a time when we couldn't because there was shutdown. And then in December they offered the vaccine, and frankly, I was like, I don't know, I'm not sure that I wanted her to be a part of that first round. But then I really thought about the risk of the vaccine versus the risk of her catching COVID, and we know that the majority of the deaths related to COVID-19 are our seniors. And so I waited, I prayed on it. And I gave my permission, and she had her first vaccine, and she's had her second one and has had no negative influence. So I think the more of us admit that we're nervous, that this is all still uncertain, and that we are relying on faith, that we will be protected. But in my mind, our higher power, our God, is allowing for these vaccines to be developed, and so then we should allow ourselves to be able to take advantage of His bounty in that regard.
Thank you. Thank you, Mr. Washington. Lady Linyar, I know right now, on last week, Dr. Ken, he did put the call out that we can return to church. Can you tell me, with that call, what have we done any advertising showing what we've done in the church and different things like that?
I'm sorry, I was muted. Sure. Yeah, we have actually had a video out, I think for the past couple of weeks, to show people exactly what takes place when they come into the building, if they choose to come into the building. We show our sanitation process, we show our check-in process, we show our social distancing process. And again, for us, we made the call, we made the offer, the invitation for those who wanted to come, limited capacity, of course, to come, because our concern in serving the needs of those most vulnerable, the needs of our community and our parishioners, is the whole person. And we know that the isolation has not been an ideal situation for any of us, let alone those persons who, again, who may live alone, whose family is found here at the church. And so we did place the invitation, and we have done our marketing, and we've let people know, if you want to come, you do have to wear your mask. Nobody will be up close on you. The sanctuary, the lobby, the common spaces are sanitized continuously, and then there's temperature checks. So yes, we have put it out there because we want people to know it's an open door. And then again, if they continue to stream with us, they're not feeling like they're not a part of the family, because we engage with those who are streaming. We will continue to do so. I think the having to stream in a more excellent way has stretched many of our, challenged in a good way, many of us who need to reach people that way. And so it challenged us in a good way, and we're going to keep moving forward with the streaming, but also we're welcoming people back with open arms.
Yeah, the streaming, I can tell you personally, has been a blessing for me, because I can't come right now to Dream Life, or anywhere else, as you know. But it's that I noticed personally, my child has said, "Ma, I don't want to go outside right now."
Mm-hmm.
And so I kept saying, "Come on, let's go, let's go." We would go because I have to go to the market. I have to do things like that. And I
Mm-hmm.
found that she would shy more away because we watch the news and the news kind of looks bleak.
Mm-hmm.
And so you need that extra push or that extra invitation from the church and from the state, from our state government, and from
Mm-hmm.
our healthcare workers saying that you can come out and we
Mm-hmm.
got you. We're your family, And I've seen the invitations from Dream Life. They're great. They're wonderful. Just saying, hey, it's safe. It's
Mm-hmm.
safe. It's safe. Because
And
that's what people want to know is that it's safe.
well,
Mm-hmm.
I don't know that we could say it's safe. What I heard the pastor saying is that they are taking the necessary precautions to ensure that you're safer.
Yes.
The thing is, what the Baltimore City Health Department is finding is that the fastest growing rate of infection is between 12 and 39-year-olds. So now, the older people are being safer, et cetera, but our younger people are still sort of, doing what they do. So we do have to learn how to live with this because the pastor is right. The isolation kills.
Yes.
The loneliness and depression kills.
Yeah.
One
That
of the
mental
things
health.
the state data is showing, and police data is showing an increase in domestic violence.
Absolutely.
And also, something the state is doing is that we're putting more money into the schools for behavioral health,
Mm-hmm.
for counseling. You'll be seeing that coming through in our budget. We are putting more money in the counseling. We're putting more money in tutoring, and we're going to put more money into summer school so that more children can go to summer school and start that transition back. Because think of it. We've got 2, 3, 4, 5-year-olds who've spent a whole year not interacting.
True.
And then you have teenagers who in their years where they're supposed to be learning how to be with other people, not having that experience. So even while we get through the public health crisis known as COVID-19, there's going to be social and economic challenges that we have to start preparing for now. So, yeah.
That's true. And can I speak to that really quickly?
Sure.
That you said about, the isolation is so detrimental. And I think that we have done the most and the best we can do in terms of isolation. I think that with the knowledge that we have with the social distancing and the masking, for me, I personally made the decision to allow my children to go back to school in person because the isolation, I could see it taking a toll on them mentally and emotionally and socially. And for me, that's not a chicken I want to put in the fight if I don't have to. And so we send them with their mask on, and we pray over them with people of faith, and we ask God to cover them according to Psalm 91, because like the senator said, we have to find a way to continue to live even in the midst of this.
Absolutely. And when I say we're safe, not that it's safe to come out, but that we're preparing a place to make it safe for you to come in. That's when I say safe, because we're trying to prepare places as safe as possible for people to come in.
But
Yeah.
the why I said that is that we're having this conversation among us, right? That we know some of us think I get the vaccine and they're going to go back to doing things the way that they did, and we really can't. So that's all I said, is that there are people. I didn't think that you did, but I do think there are people out there that might think that if I have the vaccine right now, I'm not going to get it. It just means that you may still get it and you could still give it, but you won't die. I mean, that's sort of the difference. So, and you're right, wearing masks and doing those things and making sure that the rooms are ventilated properly. So some of our schools, they are ventilated properly and they can socially distance. Other Baltimore City public schools aren't set up, for that. So we really have to go on a case by case basis. There are congregations that I see that they have made tremendous changes, and look, I would feel comfortable going in, and I would, encourage anybody that feels comfortable. And, I do just appreciate the way that everyone's trying to work through this. And Pastor, something you said earlier, that, not making people feel that they are no longer in God's love if they choose not to be in person. I think that was something in early days, that some people got that impression. It's just really making sure that people can work, that we're meeting people where they are. So I really appreciate you saying that. So. Sorry, I'm talking too much.
Oh, no. This is a great discussion. I'm enjoying it so much. But I want to include Miss Stephanie here. I don't want her to just, I know she has some great things to say. Miss Stephanie has already had the vaccine. Stephanie, can you tell us about your experience and everything?
Yeah, absolutely. I mean, honestly, I'm even in the health profession. I was still very grateful for getting it, because if I didn't, like I said, work in the hospital setting, I don't think the vaccine would have been readily available for me. It would have been a little bit more difficult. So I'm very, very blessed that I was able to get it as soon as I did. I got Moderna, and for the most part, I was relatively, besides a typical kind of sore arm the first go around, second go around, I may have been a little bit tired and achy, but other than that, I seemed to fare well. But honestly, I haven't been doing anything different than I was beforehand, because, I think, I don't want to speak out of term here, but just because I am vaccinated, that doesn't mean that I still am not a carrier myself. So, I obviously need to continue to do my part in the society to make sure that this continues to decline and the numbers go down, and that we can have everyone be able to feel comfortable enough to go back to church, to school, to just outside period. I think mental health is super important among every demographic, and it's great to see that you guys are doing so much to help that, because isolation and just anxiety in general is can be a killer to the head. So I'm, like I said, very blessed, and I'm hoping that this J&J shot will come out and we can get more people with that one dose. And I believe, again, I heard that the J&J has a little bit better as far as when you get it, you're not as contagious, I would say. But again, I'm just excited. I just want people to be able to get it, period, whether it's Moderna, Pfizer, or otherwise. But like I said, I was very privileged to get it when I did. My company is not requiring it yet. And I know a few of my coworkers have yet to get it because they are just a little still shaky about it, which is totally up to them. And that's why I still continue to do what I do, as far as even though I'm vaccinated, because they are not, and they're my neighbor and they're my colleagues. And I'm going to, continue to do what I do to make sure everyone's safe.
Absolutely. So I have a list of questions here that I'm going by. I want you guys to know that I'm not just, flying off here. So my next question is about the rest of the year. And I think Senator Washington already started into that, the rest of the year, and what may, the rest of the year and what this whole pandemic may bring as far as women and children, because now they've had the stimulus come out. They've had one stimulus, they had two stimulus, they're talking about a third stimulus, but you still have so many people who haven't returned to work. You have so many people who, when they return to work, they still have bills that are behind. You have so many people who are feeding their families, from the community service boxes that are given out. And so, what do we see as happening as the year goes along? And I think you started on it. And what plans do we have to help these people?
Oh,
There you go.
first, if you want to, about what you see in the next year.
Did you say me?
Yeah.
Okay. You were muted at first, so I missed the first part. No problem at all. Over the next year, I do see people, as we are starting to see people becoming a little bit more comfortable with getting out. I am prayerful and I am hopeful that in our emergence, that we would still be aware that this thing we need to keep ourselves protected from as much as possible. I think people have come to terms or are coming to terms with the fact that this is here. uh it's probably going to pop up its ugly head, uh, to the extent we don't know. I think that this is a huge tester right now, that we come out, that we emerge, we continue to do what we've been doing and watch the numbers. Let's see. Let's see if people can find some sort of new normalcy by living their lives, interacting on some levels, enough levels to cause people to feel alive again, and then watch the numbers. I think that as a community and even as a human race overall, I think if we could begin to emerge and keep these things in place and keep these numbers at bay and keep these hospitalizations and deaths at bay, I think that we will find a new normal where all of us will people will feel more comfortable in finding a way to live a fulfilling life, even in the midst of it. And with the vaccine, the disparities that the senator mentioned, it's nothing new to persons of color and people in urban communities. But I do hope and I pray that we hold our officials and our health officials and our government accountable, like the senator is doing, to get these vaccines out. And I'm praying for great results with these vaccines and that people will begin to get the vaccine. I think the more people get them, the better. I know there are going to be some people who choose not to get them, but the more people, more lives we can save, the better. So that's what I see over the next few years. I see people finding a way to make the new normal okay, being okay with it and getting out and living some sort of fulfilling life and just embracing it for what it is.
Yeah, I agree. Just finding out what we're meant to learn from this process, this time, this time, as you said, beginning, sort of slowing things down, but also how do we communicate with each other in these different ways? Mm-hmm. And also it has just brought to light some disparities that existed already, the racial and economic disparities in education, in healthcare, in economics that existed prior to the pandemic have gotten worse. So it has made it, you cannot ignore it anymore. Just like George Floyd, Sandra Bland, and others brought to light, white supremacy and racism and excessive force, that it's always been there. There are certain flash moments, and I believe that that's what this is. In terms of state, we've got to support health, childcare. I mean, I think, unfortunately, as a society, United States and Maryland has made the decision to basically treat school as de facto childcare. And I think finally people found out and realized how important the work that teachers are doing, but also the need, if we're going to have a healthy economy. This isn't just a woman's issue, although I'm raising it in this forum because we tend to be the ones that are most responsible for childcare. But the state as a whole, the community as a whole has to recognize, how do we care for our children when they're not in school? How do we care so that women can work? One of the other data facts is so many women have left the workforce. all of the gains, that women have made, over the last 2 decades are slipping back because they've had to stop working to care for their children because they're not in school, or to homeschool their children. And then also the other 2 issues are housing. Look, we're stopping evictions, but at some point that's going to stop. And, people, it's not just, we need to provide rental assistance, because if you're a property owner and you're a landlord, you've had a year of no rent. And again, we don't want to put people out in a pandemic, but, we need to be able to provide that. We can't just simply say you can't evict. You have to also provide economic support for those rental facilities, and then also to the renters, and then continue the contract tracing, figuring out how do we open up our businesses, how do we continue to support families. I mean, there's just a lot. There's a lot to do, but I see us doing it. I'm actually really hopeful for the next year. We've gone through a lot, and to not get too political, the last 4 years was very devastating on so many ways. And the fact that there is relief coming with this new administration, I think we'll not only have the support that has been on the ground through the churches and the organizers and the people who've been taking care of the least among us over this 4 years. Now we can look to federal support for those efforts. And I'm very hopeful.
Yeah, I think we're going to see a new world, but a better world, because we're going to see people helping people more. I think that's one of the things that this pandemic has really brought out, is that we have to look out for our fellow neighbor. We have to look out, what the Bible says, lady, love your neighbor as yourself. And I believe that's what this whole pandemic has done. It has caused us to really step into loving our neighbor, looking out for our brother. I am my brother's keeper. And so with the bads, there have been some major goods, if that makes sense. There's been some major goods, because how many times before now have we seen the church and the state work so closely together to take care of each other and everyone else in the community? This has been a great undertaking, and I think in many states there's been great work done for the communities. We're about to end soon. I would ask for any last words, if you have some that you want to share, as far as about coming back to church, or about coming back out, or about I know what my last words would be, but I don't know what last words you guys might want to have. So I want to give you this time to share. Stephanie, would you like to go first?
Sure. I've been able to get to know Rachel, which is Lydia's sister, and her awesome work she's been doing at Barnes Memorial, and it actually blows me away. And I'm just impressed by her, and everyone out in the community like her, and Pastor Lennar. I wish I could say that I've had the time to go out and do so as well, but it's hard. It has been hard to look at the good this past year. So I would like to switch that, this year, take that negative and turn it into, that positive being overwhelmingly more than the negative. And I think, politics aside, it's been a crazy year, with everything in the world. And, I'm really hoping just for some unity and some safe health, and, getting back to this new normal where things are safe and good in the world.
Yeah, me too, Stephanie. Me too.
Yeah.
Lady Linyar, would you, Pastor Linyar? I have to remember, I've been calling you lady for so long, and not Pastor Linyar. But Pastor Linyar, your final words.
Yeah, I'm just so grateful that, God, like you said, Lydia, has a way of giving us joy in the midst, right in the middle of sorrow. He really does. And, for us, even as my husband and I, we transitioned to doing online counseling instead of meeting at our office. we started counseling people, via these sorts of platforms and Zoom, and doing marriage counseling, and doing premarital counseling, and doing, just all sorts of pastoral counseling we've been doing, virtual speaking engagements, and, different things like of this nature that have sharpened us. It really has sharpened us and expanded us and stretched us in good ways. And so, I'm just thankful that this season for me, from a spiritual perspective, this season has really brought to its knees many of our idols, our church idols, our, things that we leaned on and we depended on that we really didn't need. And it's gotten down to the bottom line, and that's our humanity, loving our neighbor as ourselves, taking every opportunity to glorify God in our lives. And and so I'm just thankful for it. And like the senator said, and like you all are saying, I'm hopeful for the future. We don't die, we multiply. We continue to grow, continue to multiply. And this is not the first. I shared with the congregation this morning. This is not the first pandemic. This is not the first, and it won't be the last. But God is the same yesterday, today, and forever. And that is what we stand on. That's what we stand on.
Absolutely, absolutely. And Senator Washington.
Well, again, thank you. Just, Barnes Memorial and everyone that's listening, we have been through battles before. And you've always stepped in the gap in your communities. And even once you've wrestled the battle yourself, you've gone and helped others. You've been doing that during this pandemic. I thank you for that. I'm also going to ask you for your prayers. I'm in Annapolis now. We are undergoing in our 90-day legislative session. We have about 40 days left. We're going to be continuing to pass bills. We're meeting in person. We are taking all of our safe precautions, but again, I ask for your support for the health and safety of the 188 members of the General Assembly and our staff and our families, and also just look forward to continuing to represent you there. And then, when that is over in April, continuing to pick up the work to make our city and our state a better place. So thank you for having me here today. I look forward to continuing the good work you all do.
Thank you, ladies. As we end, this is, I want you guys to understand, everyone who's watching, a lot of times we don't get to see women in leadership, and these ladies are leading during a pandemic. This is one of the greatest role models we want to show to our daughters. A lot of time they don't get to see women who are leading. So I thank each and every one of you for being here and being examples to other young ladies who are trying to figure it out, that it can be done even in the pandemic. As we leave, I'd like to remind you, wash your hands, wear your mask, social distance. We are not out of the pandemic. Remember, if you want to keep yourself safe, follow the guidelines. It keeps us all safe. I remember Senator Washington told us that one Saturday. Follow the guidelines. It keeps us all safe. God bless you. Thank you for joining us. We have 3 installments this month, so check us out again on March the 20th, where we'll have a mental health forum about how to get through things. God bless you, and thank you. Bye-bye.
Thank you.